Hello, everyone. Thank you so much for waiting and patiently joining us this evening. My name is Julie, and I just wanted to make sure that you can hear me okay. If you can, if you put your cursor over the screen, for those of you who may not be as familiar with Zoom, you have a chat button at the bottom. And if you could click on that chat button, there's a bar that comes up to your right-hand side. And if you can type in there maybe where you're from or just a simple hello to let me know that you can hear me okay, I would really appreciate it. I've got a hi from one person. Awesome. Thank you so much, Mr. Decker from Portland. I appreciate it. Okay, anybody else coming through? Thank you again for joining us for Portland Regenerative Medicine Center and Biote Medical for our webinar this evening. I'm excited to be here with you. If you are still joining us, Dr. Huang is with us as well, and she's just having a little technical difficulty on the camera side of things. However, she is with us and she can hear us and speak with us. Dr. Huang, can you still hear me?
Yes, I can hear you.
Wonderful. Thanks so much for joining us, and thank you for hosting this as well and being just one of wanting to educate and share with other people in the community and more patients on how to live optimally through hormones and immunity and health in general. So I really, really appreciate that. A couple other things, if you want to also, if you're still joining us, again, I'm just going to repeat myself one more time. Put your cursor over the screen. That will pop up a bottom bar that has chat. If you would click on the chat, it opens up your right-hand side of a bar. You can type in questions. You can type in where you're from. Do we have any other providers with us tonight? Do we have any other nurses maybe? What other maybe line of work are you in? Are you in construction? Are you in finance? If anyone else wants to share, please do so. And a little bit of agenda tonight, and then we're going to go ahead and get started. So I appreciate everyone being patient. For the agenda this evening, really, I just want to tell you really who is Biote, if you've ever not heard of Biote before. We're going to talk about, I'm going to introduce Dr. Huang and a little bit about myself. We're going to review the webinar, of course. We're going to take live Q&As, right? So anytime you have a question, you can type it in the chat box. I've got a couple people on staff that are going to be watching that, as I will be as well. And towards the end, we're going to make sure we can answer as many of those as possible. If not, if you don't feel comfortable doing that, it is private though. It doesn't go to everybody. We just see it as Dr. Huang and myself and our staff. But otherwise, grab a pen, grab a piece of paper, take some notes tonight, write some things down that might be of an aha or a question that you want to maybe ask in the chat or to Dr. Huang personally, so you don't forget. And then at the end, we're going to share a couple testimonies, but also a couple specials. Marco and Kelsey are going to come on and give us an idea of some bonuses or specials that they are offering tonight for those who are joining us. And then finally, we are recording this. So I want you to, hopefully you're kicking back. It's the end of the workday, grab a glass of wine, tea, whatever it might be, and enjoy tonight. I really want this to be something that is a benefit to you, educate you, and hopefully you'll learn something to benefit your health for you and your family moving forward. So with no further ado, I'm going to go ahead and share my screen and we'll get started with some slides. All right, so welcome to Hormones, Health, and Immunity, 3 secrets that you may or may not know. And one thing that I wanted to tell you about, really, who is Biote? Biote is a training company. They're a training company that trains and certifies doctors, providers, and their staff on how to optimize hormones, nutraceuticals, peptides in ways that improve symptoms of aging and reduce risk of disease. So we're a training company that are bringing a lot of outside resources together to more providers to teach more on how to have disease prevention versus disease management. And myself, my name is Julie Ka'anapu. I live in the Pacific Northwest, born and raised. I do have 20 years of experience, over 20 years in the health industry, but my journey started in physical therapy a little bit, loved working with patients and worked towards kind of the pain management side because I hated seeing patients, so many patients still on these pain medications, which serves a great purpose for a specific time period, right? We don't want to be on pain meds forever. There's supposed to be a certain time period, and I wasn't seeing that. So working with some pain providers across the country, one actually asked me, they said, Julie, what are other doctors doing about hormones? And I honestly looked at him, I said, I don't know, what are you doing? What's working? He's like, well, not much. And that's the problem. I'm not getting my patients' levels up. The outcomes aren't doing what I want them to. They're still feeling like crap. Every medication depletes hormones even further. So I'm like, okay, well, we might be onto something. Let's research this. Long story short, a lot of research and time, I ran into Dr. Donovitz, which is the founder and owner of BioT Medical. And I came across pellets, and I had no idea what a pellet was. I associated it with my childhood rabbit. We named it pellets. It ate pellets. It pooped pellets. It seemed appropriate. But of course, it wasn't a rabbit. It's just a different route of administration for hormones, just like pills, creams, patches, and injectables. Anyway, so I met with Dr. Donovitz. He said, I am teaching more providers and I need consultants to be able to instruct and help me do this. So I spent about 6 to 8 months, my own time, my own money, going and listening and learning and researching and seeing all of the articles and studies over 80 years that this supports healthy aging. So I am super excited to be here with Dr. Huang, who has tons and years of experiences as an OB-GYN. Dr. Huang grew up in the East Coast, where she completed her undergrad degree. She was a resident of New York City, then transplanted herself to the West Coast. We're so lucky to have her here, and has been in the Portland area for a while now. Her strength in science and keen interest in making a positive impact in people's lives, she decided early on to pursue a career in medicine. She's practiced over 20 years, like I said, as an OB-GYN before transitioning to regenerative medicine. And the reason was to change this practice of medicine in a way that aligned with her philosophy of assisting the body to heal itself. And her mission as a healthcare provider is to make accessible healing modalities that improve the patient's quality of life by addressing and improving existing issues while offering preventative measures in supporting people to be their best version of themselves. She takes pride and feels privileged to work alongside patients as a skilled guide, collaborating with them in deciding what treatment path is most appropriate and best serving. And I am so thankful for you being here tonight, Dr. Huang, and coming through our trainings and certifications. I'm so honored and excited to be working with you and your team, and what you are doing and accomplishing already in this short amount of time. It is just amazing how many patients are already flooding to you and the outcomes that you're getting. So thank you so much for being here tonight.
Thank you, Julie, for that lovely introduction. And I'm very happy to be here.
Oh, you're welcome. Okay, so moving on, 3 things that we're going to talk about tonight, and we are going to chunk them in 3 hopefully short groups that may only take us about 20 to 30 minutes, and then we'll get on some Q&As and our bonuses. So one, we're going to talk about hormones, optimizing for healthy aging, nutraceuticals, why, when, and where can we get the best kinds? Does it make a difference? And then number 3, peptides. And most of the time when I talk about peptides or bring up peptides, I usually get the question back, what's a peptide? So we will talk about that in brief overview. So number 1, hormones. What are they? Basically, they're chemicals made to control certain actions of cells and organs. If you think about it, they're our coach. When a team loses their coach, things go haywire, and so do our bodies. The other thing is that hormones are like a lock and key. When you have the wrong key in the keyhole, but it sticks and now it gets stuck, that is not the right thing that our body knows and wants or needs. The right type of hormone is the right key that unlocks and unleashes benefits. And third, hormones, we have synthetic versus human identical, or maybe you're familiar with the term bioidentical. And if anyone has ever heard of, get ready to type in the chat, I'm going to ask this to be interactive. Has anybody ever heard of hormones causing cancer? Write it in the chat. Yes, 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 no, I have. And I can show you literature that shows hormones can increase risk of cancer. But have you ever heard or seen that hormones can reduce the risk of cancer? I have, and I've seen the literature and the studies, and I can prove that as well. So has anybody else right in the chat ever heard of causing or reducing? So we're going to talk a little bit of the differences, and that's where apples and oranges come hand in hand. Hormones are a big umbrella, but we have synthetic that can increase risk, and we have human identical that can reduce risk. So that might be a writer downer for you. So really, what are we searching for? We are trying to find out how you feel. Does anyone feel like they're just wanting to scream at the end of the day, or nobody will even talk to me, or just irritable mood swings? I think especially with everything that's going on, you know, we've had a lot more to deal with. Or do you feel like this, which is just trying to state, you know, we feel good in our own skin. We feel calm, we feel vital, we feel alive. And that's what we're trying to accomplish, is how do you feel? We want to treat you, the patient, not your labs, not your medications. We're using all the tools to help treat you and how you feel. So some of the things that hormones are healthy and optimize in healthy aging, or some of the symptoms, I should say, that go along with declining of hormones, are this list that you see in front of you. And I'm happy to tell you my own story as well. When I was creeping into my 40s, I started to feel a lot more tired. That afternoon fatigue, felt like I needed coffee or could take a nap. Mood swings were a little more off than usual. Anxiety, I always had just this hurry up and wait, or just this heart race kind of anxiety all the time. More irritable, poor sleep. Does anybody ever have trouble falling asleep? Or do you fall asleep fine, but then you wake up in the middle of the night for no reason and have trouble going back to sleep? Or if you were like me, I could fall asleep, be asleep, and hardly even wake up and still feel tired, like I wanted to sleep more. That was my symptom. Memory loss. Anybody walk into a room, forget why you walked into a room? I was doing that all the time. Or just meet someone and forget their name instantly. That brain fog or depression, just feel like you're on a hamster wheel. Remember that the movie Groundhog's Day? Get up, go to work, come home, repeat. Hot flashes and night sweats. Here's a good writer downer. Hot flashes and night sweats are two different hormones that are associated with these symptoms. A hot flash typically is more likely to happen in women versus men, but it can still happen in men. It's something that starts in the middle of your chest, right? Flushes up. It could last 10 seconds or 40 seconds. You could have one a day or dozens a day. That is typically an estrogen deficiency. Anything other than that chest and flash of heat is a night sweat. So a night sweat, of course, yes, can happen at night, right? Sweat, throw off the covers, crank up the AC, turn on the fan, or it could be during the day. You're just hot. And that was one of my symptoms. Would get out of the shower, you're getting ready, and I'd kind of start perspiring and you're putting on your makeup, or get in the car and just getting hot. It wasn't that flash of heat, but it was just being hot. That is typically a testosterone deficiency. And too many times, I think, patients will go to possibly the OB-GYN, and Dr. Huang, you can confirm with me or not, and they say, I'm having these hot flashes, but it's really a night sweat. And some other providers that don't understand the difference between the hormones and the symptoms immediately might associate they need hormones, or they need estrogen, and write a script for estrogen. And then you have what I call the bad Bs. You have bitchiness, breast pain, bloating, and bleeding. And it's not fun. It makes PMS look like a walk on the beach. So those two, estrogen deficiency or testosterone deficiency, is something that a lot of providers may not take the time to identify. Would you agree, Dr. Huang?
Yeah, I agree. In standard practice, it's not recognized that one set of symptoms is caused by estrogen and another set is caused by testosterone. That's correct.
Yeah, thank you. And then, of course, weight gain, joint pain, migraines, severe headaches, bladder systems, and then decreased sex drive and or performance or libido. These are all symptoms that could indicate that your hormones are not optimal. I didn't say normal. They could be normal. I don't like that word because what really is normal, but they're not optimal. And we are reaching for optimal to help clear these symptoms. Did you realize that men from age starting in their 30s can lose from 1 to 3% production of testosterone every single year? And get this, women can lose up to 50% of their testosterone by age 40. If you think about that, that is way before most of us tend to think of women needing hormones. Most of us associate, as I did years ago, hormones with menopause. However, thyroid, testosterone, progesterone, that happens and starts to decline way before menopause does. So how can we also help improve those symptoms without unnecessary medications? Well, by optimizing our hormones. And the cool thing, not only the feel-good benefits, but the other things that hormones can protect. There's major symptom relief, but it also protects 4 main areas. That's the brain, bones, heart, and breast, and prostate actually, but also relationships. And if you think about it, kind of ironic that the peak of divorce is also at the time frame where our hormones are declining. And to me, it makes sense. My husband and I have been married happily for 23 years. However, about 8 years ago when we started hormone therapy, or right before, we were tired and we're irritable and no one wants to help make dinner or clean up the dishes or help with kids' homework. And then you're too tired to do anything and your libido's down anyway. So there's no zest for that relationship or intimacy like there used to be. And when you have all that back, your relationships are so much more re-energized. And I can't tell you how many, people and couples that have come back and said, you've totally changed my life. You've improved my marriage. Just everything in their life just seems to work better or like it used to. So some of the things that hormones have been shown to protect against multiple diseases is breast cancer, cardiovascular disease, #1 killer in America. Does anybody know or willing to type in the chat? #1 killer in America is heart disease. It has been and continues to be, and the heart is the #1 organ with the most testosterone receptors on it. It is a muscle. It needs testosterone. It is protective. Prostate cancer, osteopenia, osteoporosis, eye degenerative disease. You can read all of these. It's amazing how much testosterone can help, along with other hormones, reduce the risk of multiple ones of these diseases. So why wouldn't we want our levels optimal? I don't know. Except this is one reason. So the Women's Health Initiative was a large study way back in 2002 that was done on a synthetic Prem-Pro. And what Prem-Pro is, it was a synthetic estrogen, which was called Premarin, and they had a synthetic progestin, not to confuse it with a natural progesterone, called Provera. And they thought, well, instead of women taking 2 hormones, why don't we put it into one? We'll call it Prem-Pro. Kind of actually novel thought. But when they were doing this study, they had so many increases in strokes, heart attacks, breast cancer, blood clots, and dementia that they stopped the study short. However, when that got out in the news, providers were scared to prescribe it. Women were scared to take it. But it wasn't until 14 years later, they finally came out and said, yeah, it kind of was a flawed study. And there was an arm study that they did just on estrogen alone that did not have any of those risks. And it was still a synthetic estrogen. There was a slight risk within a decade year of life on stroke. However, what they had found over that course of time, there was approximately 80 to 90,000 women that had a premature death due to estrogen avoidance. And it's horrible in regards to how the study had put so much fear in so many people and not realize the difference between synthetic versus bioidentical. And Dr. Huang, you were in still practicing when this study came out. Did you see a lot of that as well from doctors and patients being scared for hormones again, but they were not realizing the difference between synthetic and bioidentical?
Yeah, after the study came out, we saw an abrupt drop in the number of women using hormones, both due to their own fear and, hearing about the results of the study, as well as doctors being unwilling to prescribe it. So the numbers really plummeted, and basically hormones became very, I would say, less available, for the, for the, for a generation of women. Yeah, essentially.
Yeah.
Mhm.
Yeah. And wouldn't you agree? And that's what one thing, our people who are attending, to take note. And one thing I want to empower you with is understanding the difference between a provider who says hormones are healthy and a different provider who says hormones cause harm. I want you to be able to understand the difference between a bioidentical and a synthetic. Because if you just say hormones, well, which hormone are you talking about? Hormones don't cause cancer. Synthetic imitations of hormones have shown increase of risk or disease, right? So hopefully, as we go along this, you guys will understand a little bit more and feel empowered to understand why another provider may not understand. If that makes sense. Understand, right?
There's a lot of nuances, which include, the type of hormone, the type of estrogen, the type of progesterone, as well as the form of delivery, oral versus patch versus pellet. They have, yeah. So oral delivery certainly has a higher risk of causing blood clots, and certainly because that was the primary form used in the WHI study, accounted for the increased risk for stroke and probably heart attacks as well. Yeah.
Right. Thank you so much for adding that. And the routes of administration, we'll discuss a little bit pros and cons of each. But when you're looking at a study and just the title, right, hormones cause cancer, well, there's a lot of questions you got to ask with that. One, what type of hormone, what route of administration was, what type of study was it as well? So it's a great point to bring up. Thank you. And a couple studies I just want to reference. There are so many studies, and of course I'm not going to belabor the point tonight, but the Nurses' Health Study was one that was a large study done on almost 122,000 nurses, just showing again that conjugated, meaning synthetic hormones or estrogens, increased the risk of breast cancer, where estrogen and testosterone did not increase the risk of testosterone. And there's a breast cancer surgeon, Dr. Rebecca Glazer, who has done tons of studies, and she actually came out with another one, a 10-year cohort, showing the reduction of risk of breast cancer and reoccurrence and mortality, even in breast cancer patients, by using testosterone. So very, very powerful. Another one, a few studies showing down below, just showing that there's a decline in anabolic hormone. When there's a decline in anabolic hormone levels, that alone is a strong independent predictor of mortality in older men. And having, oh, I'm sorry. Go back, there we go. Having multiple hormone deficiencies is a robust biomarker of their health status. Now, the last note is really, really cool study from the Journal National Cancer Institute. And they showed a large amount, I believe about 3,000 women, all breast cancer survivors, and they had split them in two different groups. One chose not to use hormones and the other chose to use hormones. And there was an approximately 50% increase, or in less, I should say, 50% reduction in reoccurrence and or death in the women who used hormones versus who did not. So it really kind of makes you want to think, what group do you want to be in? And too many times, I think women, especially when it comes to breast cancer, are thinking about, oh, I don't want to use hormones, I don't want to get cancer. Well, who says you won't if you don't use them? And you're actually putting yourself at a higher increased risk not using than you if you were to use. So I think that's very interesting. And here's a little bit of differences between a patch, and a pill, a cream, an injection, and a pellet. And one of the main differences is that, Dr. Huang, you were talking about, oral has to go through what we call the first bypass, right? It has to go through the liver and digestive tract to be absorbed. And that's where we've seen some issues. With a patch or a cream, when it goes on the skin, if you think about it, skin is meant as a barrier. And what we have seen clinically is approximately 45% of people that don't absorb adequate levels. So you're paying this money, sometimes very expensive, for these creams or gels or patches that when you get your blood drawn or see where your levels are at, there is hardly anything there that is not giving you anything for, benefit, not to a level that is beneficial. So for an implant or a pellet, what the cool thing is about that is there's a constant steady state. If you think about it, when we are taking a pill, we're doing it once a day. If you're doing a cream, you should be doing it twice a day. If you're doing a patch, that's a little bit better. You're doing it maybe every 3 days, but you're still getting hormone and then not, getting hormone and then not. It's a roller coaster. The cool thing about a pellet is that when it is placed just in the fatty tissue of your skin, capillaries form around it. And how we originally have hormones going through our bloodstream is by cardiac output. So if we are stressed out, no one's stressed, right? Working out, fight or flight situation, heart rate races, tells pituitary in the brain for ovaries or testes to literally spray hormone into our bloodstream. As we age, we have poor sprayers. We don't have the levels anymore. Ovaries and testes just stop working as well. But when that pellet is in the fatty tissue, capillaries are there, and your heart rate increases, it goes by absorbing more as you need more. But when you're resting, that blood flow slows down as you don't need as much when you're resting, but it's on demand to your body. So you have this constant steady state versus a roller coaster effect. And the other cool thing about the pellets is that they are, of course, human identical. They're plant derived. It's on demand to the body. There's no fillers. It is not time released. A time released is an injection, which has fillers, which are oils that can have allergic reactions to, and that still has to go to the liver to cleave off to be able to use the right hormone. Pellets have been around since 1939. They've been studied and used in over 5 different continents around the world. They're one of the most studied, most efficacious forms of delivering hormones. Most people do them 2 to 4 times a year instead of 2 times a day. And the dosing is individualized. And that's what's so important when we are teaching and talking to our providers. We're talking about how do we individualize each person's therapy. And too many times, I believe that prescriptions are more of a one size fits all, or there might be 3 different prescriptions, but everyone starts at the same dose, and that just doesn't work. So it's safe, it's hassle-free, and you don't even know it's there. And if you have any questions about more of that, we can ask them at the end or put them in the chat. And Dr. Huang or Marco or Curtis, if you guys see any of those, I can't see those right now. So if there are any Q&As, would you please just interrupt me and let me know? This is a cool slide. And this is a German study done looking at the levels of testosterone in men. Now, we know that men need about 10 times the amount of testosterone that a female does. Females definitely need testosterone. Men still need estrogen. It's just the amounts that are different. So if we, general rule of thumb, if we take a 0 off of each one of these, you can kind of apply it to women. But what's interesting is when it comes to, has anybody ever gone to a provider before and said, oh, I've had my hormones checked and my doctor says they're normal, but you still feel fatigued, joint pain, increased weight gain, irritable brain fog, and all of these symptoms. You're not Prozac deficient. You're not Ambien or Lunesta deficient. You're not deficient of any other medications that don't have a short time frame to help you through something. When we look at levels, most labs for men might be between 300 to 800 or 900. This is a reference range. So when a provider might say, oh, your labs are normal, all that means is you fit within this reference range. So you think, okay, well, where is optimal? Where are you going to feel and function your best? Only you know. No provider or number on a lab can be decisive of how you feel and function, right? Only you know that. And that's the cool thing about working with Dr. Huang, is she'll be able to discuss and talk to you and individualize your therapy to be optimal for you, specifically for you. To give you an idea, my husband, he's 52 now. He was 45 when he started pellets. His levels were at 327. He was at risk of coronary and heart disease, fatigue, of course, libido loss, type 2 diabetes, overall dying mortality of all cause, metabolic syndrome, osteoporosis, prostate cancer, mortality, Alzheimer's disease. Yet his provider told him he was normal. I don't know about you, but I kind of wanted my husband to be around a little bit longer. So normal is not optimal. My levels was 26. And that was back when I was just right before, I was like 39, going into 40. And obviously, again, we're general rule of thumb, right? Using this for women. But I also had fatigue. And it wasn't majorly bad for me, but it was fatigue and irritability and brain fog, joint pain. But again, I was normal. So I want you to also think about, hopefully this is a take home for you, normal is not optimal. Anything else you want to discuss on this, Dr. Huang?
No, I think that's an excellent slide. Yeah.
Okay. I agree. And it's nice to be able to show patients and see, you know, where their levels are and be like, oh yeah, my symptoms are this way. No, I do want to be. And this is why we want optimal ranges, to reduce risk of disease. So talking about hormones and where BioT and Dr. Huang has gone through certification and extensive training and continued education, we're looking for the right kind of hormone, right? A bioidentical, or what I call human identical, not a synthetic. We're talking about the right amounts, an individualized dose, right? Not a one size fits all. The right delivery system, a pellet is the closest form of how your body actually gives itself hormone that we can get to. And then testosterone, estradiol, progesterone, thyroid, these are all hormones that we are looking at to optimize that fits you best. And technically there is no age where hormones, you know, oh, you turn this age, now we need to look at your hormones. Hormones can start getting out of whack with thyroid, you know, early on. Women start to decline typically with testosterone in their 20s, especially with a couple pregnancy cycles. Men typically start to decline in their 30s. So even though, you know, you may look fit and be healthy, if you're starting to feel just not as good in your skin that you used to, I would encourage you to get your blood work, have a conversation with Dr. Huang. It might be life-changing. So that's all we're going to talk about in that first group. The second group or thing that we're going to talk about is the nutraceuticals. Why nutraceuticals? When? Where? Well, first of all, farmland in the USDA reports that the farmland in the US is over 85% depleted of vital micronutrients. And that's pretty crazy. If you think about back in the 30s, one bowl of spinach back in the 30s, the iron content in that one bowl, to equate that same iron content today, we would have to eat 12 bowls of spinach to get the same iron content in that one bowl back in the 30s. We're just not turning it over. We're looking at less expensive ways, and it just isn't there. So when someone says, well, I eat organic, I eat as best I can, absolutely most important to do now more than ever. But unless you know that the garden where you're getting your food, or if you have your own garden that has turned soil, it's just not there like it used to be. Also, you know, no one drinks wine anymore. That's not me, I promise, but it would be. Poor food quality, right? And our choices sometimes aren't the best. Our health conditions, any type of medication you take, even if it's Advil, is going to deplete some sort of nutraceutical or mineral from your body. Excessive alcohol, of course, soil depletion, stress, worry, processed foods, sugars, everything else that'll take away from the vitamins and nutrients that we need. And a lot of people, I get a question, so, well, where can I get these? Where's the best place? Can I get them at Costco or, you know, Walmart or wherever it might be? You can, but there are 5 issues that I've come across extensively with over-counter supplements. One, they could be cheap and poorly absorbed or used by the body. The dosage on the label may not match the actual dose in the pill, which is kind of scary. Tons of additives, colors, fillers, and allergens in some of these nutraceuticals over the counter. The raw materials that are used may not actually be tested for toxins, and you might be actually putting something worse in your body than you think you were trying to do benefit. And then they may have definitely lower manufacturing standards. The one thing with all of the nutraceuticals that BioT is partnered with are through Thorne Nutraceuticals. Thorne is one of, if not the largest nutraceutical company in the world. They are NSF certified. They are the only one that has partnered with the Olympics and the new US national team and UFC. They've chose Thorne as their official sports performance nutrition partner. And of course, all of those athletes are being tested. And the other cool thing about Thorne is that they have a lot of literature and studies done that have even been printed in the Mayo Clinic. So all of these are some great, very essential nutraceuticals, but we're not gonna talk about every single one of them. DIM is great on methylation, on metabolism of hormones and weight management. Methylation is a robust indicator of gene expression at times. Iodine, we are going to talk about. Artericell, anybody with cardiovascular disease or on statins, definitely reach out to Dr. Huang about Artericell. We are going to talk about vitamin D, our ADK, K2. Probiotics, we're going to talk about those as well. Curcumin, great for inflammation, and omega-3 and CoQ10s. We must have healthy fats for our whole entire brain, nervous system, and CoQ10 for the heart. Anybody you know is on a statin, that actually depletes CoQ10 from the heart, so it's essential to supplement and put that back in. But the few that we are going to talk about is AD and K. It's a K2. There is K1 and there's K2. K2 is actually made in the gut. But when it comes to vitamin D, most of us know and feel that it's important to have. But 7 out of 10 Americans are deficient in vitamin D. It helps with building muscles and bones, reduces risk of cancer when at an optimal level, supports the immune system. It's vital for healthy hair and nails, thyroid function, has antiviral effects, and shown to reduce developing respiratory infections by 42%. Now, when I talk about what's optimal, you may have that question. If anyone's putting it in the chat, studies have shown that when your levels are above 60, you have a decreased risk in cancer and all-cause mortality. It actually has been shown to kill cancer cells and stop the spread of cancer. Those reference ranges, if you've been told your vitamin D is normal or normal low, let's just watch it. I always love that question. I'm like, watch it what? Get worse? You know, the reference ranges are typically from 30 to 100. Yet so many patients are borderline 30 and way, way below. Dr. Huang, have you ever actually seen a patient with a vitamin D level above 60 that isn't supplementing?
No, I have not. Yeah, usually they're at 60, they're pretty consistent with their intake of vitamin D.
Right. And what would you say is maybe a typical average vitamin D that you've seen in patients?
Well, I would say people are becoming more aware of the importance of vitamin D. So I do see people taking it more consistently. So I think the levels I'm seeing, I'm seeing a lot of above 30, which is in the quote unquote normal range, but not necessarily.
Right.
What I do see is that there's still not a lot of awareness about the importance of vitamin K2, and how important that is in making sure that the calcium winds up not in your arteries or in your soft tissue. So something that I'd like for patients to become more aware of is the importance of taking the D with the vitamin K2.
Yeah, absolutely. And so glad you brought that up. And that's why we've put in one tiny little capsule AD and K2. AD and K2 work so synergistically together. Like you said, you're not going to have, it's so funny. So many people are like, well, what about toxicity on vitamin D? It is so amazingly hard to get toxic on vitamin D. But also when you have that vitamin A, they counterbalance each other. But that K2, I call kind of that police traffic control, right? It sees calcium coming here this way and it's like, nope, you can't come in here. This is the heart, soft tissues. You got to go this way into the bones and the teeth. And it does, it helps, it's a domino effect. You can't get the final result without all three. And I think that's really, really cool. And thank you for bringing that up. So probiotics, oh my gosh, I know probiotics has been much more advertised and being more aware. But a lot of questions I get is, why do I need a probiotic every day? Again, I'm eating healthy, yada, yada. Well, we live in such a toxic world. The air you breathe, the water you drink has fluoride in it, or the plastics we eat or drink out of, the bromide that, we bathe in from maybe our dryer sheets, everything that we're going through is killing the natural flora and the good probiotics that we normally already have. So it really is important to replenish that on a consistent basis. Also, high sugared and processed foods. Anybody on an antibiotic? I have a question. Anybody ever been prescribed an antibiotic? Also been prescribed a probiotic? I know I haven't, or it wasn't typical. So really, really cool in regards to probiotics that can restore that flora. Chemo, radiation, of course, steroids, and acids. When someone has that, you ever have indigestion, right? Heartburn, you're taking Tums, that is helping the symptom, but it actually can make the problem worse. So when we have flora from our esophagus to our stomach to our small and large intestines that all have different jobs in different areas. And when we lose that, our stomach becomes inflamed. And one of the things that we do have in our small intestine, these villi, they're kind of finger-like, right? And they start pretty tight. When we eat, we release something that loosens them a little bit. So it allows the good proteins to come through and absorb into the bloodstream that we need, but it's not big enough to allow the bad ones that we want to expel, right? So that's the good thing. But when we have a poor diet or inflammation, we don't start tight like this. The villi in our intestines start already separated. So then when we eat and it gets ready to digest or absorb, it spreads out even further. So not only the good proteins get in, but the bad ones get in too. Basically the crap, let's call it what it is. And that's where that term leaky gut comes from. You're actually absorbing the crap that you don't want. And if you aren't going every day, if you aren't going at least once a day, you are constipated. You should be going every day. So that's another indication of needing a probiotic. But a couple things that I like to remember on what they do: it helps with digestion, it helps with immune support and inflammation, helps with vitamin production that happens in your gut, and elimination. We should be going. So the cool thing about this probiotic is the capsule and the 20 billion IUs that are in there are guaranteed to still be there at time of expiration. The majority of different probiotics state that the amount of IUs that are there is at the time of testing, not expiration. So you're guaranteed to get the amount that you need, and it's guaranteed to resist the majority of the stomach acid. And that's also why some probiotics say, oh, well, we have 57, 100 billion IUs. Well, because 97, 98% gets killed off in stomach acid. So they need more to be able to get a little bit into the small intestines. So this is something that's going to do both for you. The other cool thing, that especially during the times, is iodine. Iodine is vital to the body and crucial to the thyroid. The iodine that Dr. Huang has in her clinic also has selenium and zinc in it. And this is really cool because this supports not only respiratory, but also thyroid function. Anybody ever feel like their thyroid's been off, but you've been told it's normal? I know a lot of my friends have told me that before, and that could be from metabolism, thinning hair, brittle nails, constipation, just fatigue, unexplained weight gain. Well, the thyroid needs and will steal iodine from the body before it gets anywhere else. And selenium and zinc is crucial for a conversion of what we call T4 to T3. All that is a thyroid with an iodine molecule, 4 iodine molecules versus 3. But we need both when it comes to thyroid for blood-brain barrier and anything you like below the neck. So weight gain, metabolism, heart health, cellular regeneration, constipation, skin, hair, nails, everything below that, you need that T3 conversion. And selenium and zinc can help do that with iodine. And thyroid, I'm sure there's tons of thyroid questions. Definitely talk with Dr. Huang on a one-on-one level, and she can definitely get the right tests that many providers just don't understand or overlook. So anything else we want to talk about on any of those nutraceuticals, Dr. Huang? We'll go into our next section.
No, I think you covered it pretty thoroughly. Just the iodine supplement, it's very topical now that the selenium and zinc are also, extremely good for the immune system. And I would certainly recommend that people, in this era where we're very concerned about infection, that we have that as one of the supplements that we take. Yeah.
Great point. Thank you. Oops. Okay, so second section is done, our last section for the evening, then we'll go on to bonuses. So peptides, really, what the heck is a peptide? I don't know if anybody's heard of a peptide. If you have, maybe put in the chat below. But basically, it's a group of amino acids. And I think most of us are familiar with the word amino acids. So it's between an amino acid and a protein. There are groups of amino acids, short chain amino acids, connected by a peptide bond. And these common examples might be creatine, collagen, and I think those are probably most familiar. But there is many, many peptides out there. It is what our bodies already make. So again, we're replacing it similar to bioidentical hormone replacement therapy, right? We're mimicking these peptides already found in the body. And this is kind of a cool slide just showing that peptides have been around way before the 80s, newer, right? Not 100 years old, but increasing dramatically. And this only goes back to 2015. And ever since, there's even been more. And they're amazing tools to help treat the patient in a more precise and specific manner for a whole host of conditions if needed. And I just want to go over a couple of these, actually a few, of who is peptides useful to. So peptides can come in many different forms, but they are helpful for those with a compromised immunity, cancer patients, anorgasmia, trouble orgasming or climaxing, erectile dysfunction, topical spot fat loss, think of instead of Kybella or love handles, tissue repair, muscles, tendons, arthritis, plantar fasciitis, muscle gain, skin improvement, anxiety, hair loss or thinning, prevention of Alzheimer's disease, metabolic disease, if you have trouble sleeping, nerve and joint repair, and overall gut health. Almost like, yes, sign me up, how many can I take, right? And then there is tons of safety and testing on the peptides that Dr. Huang has access to that we want to make sure is the highest of quality that we're partnering with. And then the peptides that most are used for is viral illnesses, sexual function, right? Fat and weight loss, gut health, digestion, or treating even ulcers, tendon and ligament repair, inflammation, tendinitis, bursitis, wrinkle reducer. Hello, ladies, right? There is what they call Botox in a jar, made for those areas that you can't really get Botox to very well, or under the eyes or décolleté, excuse me, or to help improve the Botox length overall. Other skin improvements for psoriasis, anxiety, skin tanning. Get this. Sleep quality, of course, patients with osteoarthritis and gut dysbiosis or inflammation. So many things that these natural peptides, again, things that our body is already making and having, but reduces with age or gets from aging and our environment are reduced or damaged. If we can replace what we've already had and what our body has already been used to and can heal by, that Dr. Huang was so passionate about, then we can improve how we feel, improve how we function, and reduce risk of disease. And that's really what we want to be able to do, is talk with you and be able to individualize therapy that's going to be best for you. So really our key take homes is hormones, right? When optimized correctly, we can definitely improve symptoms of aging, reduce risk of many diseases. The nutraceuticals, they're imperative for optimal health, even when we're eating well, right? And many have false labels, so who to trust? You want a high pharmaceutical grade nutraceutical. And then peptides, they're the building blocks for proteins. They have immune boosting and anti-aging properties. So Lastly, though, you definitely need an expert to individualize your care. If you go to a different provider and talk about hormones and they say they cause cancer or they cause stroke, you should get off of that. Again, understand why they don't understand. There's some of those studies like the Women's Health Initiative that had that big scare. You have someone right here, right now. Dr. Huang has gone outside of the box. She has taken the time to research and study the years, 80 years of research and literature that is out there to be able to help patients like you. So next, I want to just bring on either Marco would you be willing to share your experience with some of your therapy?
Yeah, I'd be happy to. So just a little bit about me. I am 33 and I considered myself to be very athletic and fairly healthy. I had a few different symptoms that I was working through, like lack of sleep, low energy, brain fog, some of those same symptoms you were talking about. And I attributed them all to stress. I had never considered that at 33 it could be a hormonal imbalance. After going through my consultation with Dr. Huang, she looked at my testosterone levels and my estrogen levels and all of my key vitamins, and I was low in testosterone. And after my pelleting, the very first thing I noticed was a dramatic change in sleep. I keep a little bio tracker ring that tells me exactly how much deep and REM sleep I get, and it doubled in both.
Wow, that's awesome.
And after that, I would wake up with more energy. With more energy, I had a clearer mind. And so each one of these things contributed to and made the others worse, but none of them was the cause. None of these things was the root of my issue. The root was an imbalance in my hormones. So once I was able to optimize those things, I felt much better in all of those areas. And on top of that, my stress was easier to manage. So
yay, that's amazing. Thank you so much for sharing. And I think just like you had stated at 33, you said, right, not a lot of us are thinking that it's hormones, and any other typical, I guess, or conventional provider might just give you a medication, right, to be able to manage that or get through it. But then you got to ask, well, how long, once I stop this, did we really solve the problem? So that's great. Thank you so much for sharing, Marco.
thank you.
Dr. Huang, did you want to share anything else, or should we go on to Kelsey?
Yeah, I think Marco's story is a story that I hear quite often. Yeah, I would say sleep is definitely a category that gets improved for a lot of people. And once you get restorative sleep, it just helps with so many aspects of your life. Yeah, so myself as an OB-GYN, I was used to having terrible sleep and feeling tired. And I didn't realize that part of that was also, due to perimenopausal hormones. And so when I got pelleted, I felt, gradually an improvement in my level of energy, brain fog, and, I just feel much better for sure. Yeah.
Awesome. Thank you for sharing. And I have one question, and maybe Kelsey will talk about this, but when someone sets up a consultation with you, are they getting their blood work and then a consultation to discuss it, to just really see what the next steps might be, kind of put a plan in place and discuss together? Would that be correct in saying?
Yep, that's definitely the important next step, is having a consultation, to kind of discuss the whole process of getting pelleted, getting the labs, so that we can personalize treatment. Yeah.
Awesome.
So.
Okay. Thank you so much. Is Kelsey here to talk about maybe some bonuses or incentives?
I am here. We are excited to be,
Kelsey.
Yay. We're excited to be able to offer our webinar listeners a valued of over $100, a free bundle of our BioT nutraceuticals for post-pelleting. So be able to optimize your results with that bundle of nutraceuticals for free this month only.
Awesome. Okay, so if I heard you correctly, this month, the entire month of August?
Yeah.
Oh, cool. Okay, so the entire month of August, if someone has a consultation, blood work, and they see fit to move forward with a pellet therapy, then you're giving away for free a bundle of nutraceuticals?
Correct.
Wow, that's very generous of you guys. That's awesome. That's awesome. Which goes to, you know, I just, I'm biased maybe a little bit, but I love you guys so much because you truly, and one of the things I respect about Dr. Huang is that it really is about the patient. You guys are always about what's best for the patient, giving, you know, so I just really appreciate all of you as a team so much. So.
Yeah, thank you, Julie.
Thank you.
Yeah.
Oh, you're welcome. So is there any, I can't see anything in the chat. Is there any other chat questions?
I have a few of the questions and I can read them. And a few of them I'll have you answer, and then a few of them are posted directly to Dr. Huang.
Okay.
So
read away.
The first one we've kind of addressed a little bit. It asks, birth control pills. My OBGYN recommends an estrogen patch and a progesterone bioidentical pill, Prometrium. How is your program different? So Julie, if you could answer a few of these questions, we will just add some details.
Of course. So I'm going to repeat the question, make sure I understand it. So this patient is stating that her provider prescribed a birth control pill and a progesterone patch?
Correct, Prometrium. And she's wondering how this one differs from the patch and the pill.
Okay, well, for one, a birth control pill is going to control your ovary, right? So it does not produce an egg, which is a good thing if you don't want to get pregnant. And if that's the reason, unless maybe you have PCOS or maybe there's other variables that we can discuss offline, but if it's just for birth control, then continue your birth control. But the one thing that it also does when it controls your ovary is it typically almost shuts off the production of any testosterone. So depending on your symptoms, depending on your medical history, depending on your labs, your baseline, meaning your just natural levels, all of those things we would take into consideration to see if testosterone is something that would help improve those symptoms on the go forward. When it comes to Prometrium as a patch, that is a bioidentical progesterone, but there are studies that show that a patch or a cream in a progesterone is not adequate, or we have not seen adequate levels to be protective at the endometrial level. So when you have estrogen builds up the bloodline level or layers, right, in the uterus. It's kind of like the fertilizer of growing grass, and progesterone pulls it back. It's kind of like the lawnmower. So it keeps it in a protective range. And what studies have shown, some studies have shown that a patch or a cream did not give adequate absorption to be protective at the endometrial level. So there was more estrogen, the progesterone was not coming through enough to keep that lower. So what we suggest, and Dr. Huang would, of course, with you and discuss together, if progesterone is something that is a benefit for you, usually an oral is safe with progesterone, and or a troche or a rapid dissolve tablet. A troche is almost like a cough drop you can suck on, or a rapid dissolve tablet is something you put on your tongue, and it's like a baby aspirin. It's just like totally absorbs right away. So I hope that answers your question. And of course, Dr. Huang can have a one-on-one with you and discuss even deeper and further.
Yeah, I guess I would say the biggest difference between what your OB/GYN is recommending is the absence or presence of testosterone. And so through either the patch or birth control pill, you're not getting the benefits of testosterone. Yeah.
Right. Great, thanks. Great ad.
So the next question that we have here is whether we offer anything that boosts HGH production, if this helps with that.
Good question. And so when we have optimal levels of testosterone, we have seen about a 20% increase in human growth hormone. So we have seen that. there's not too many providers or patients that are doing HGH anymore just because it's so expensive. And when we optimize all of our hormones, we do see a natural bump in that. And a lot of patients have been happy.
Wonderful. And then the next question is, if someone gets hormone treatment, is it something to help balance out your levels moving forward, or do you continue to get the treatment?
So you continue to get the treatment as long as you want the benefits of the treatment. You can stop anytime. Your body will go back to its natural level of what it used to make, minus the years or time frame that you were on it with age. I kind of associate it to eating and exercise. How long does it take to eat healthy to be healthy? Or how long should I exercise to be healthy? Well, you never stop. You continue as long as you want the benefits. So with bioidentical or human identical hormones, we see benefit. There is no harm. Any symptoms of excess I can talk about, but they are temporary, they're treatable, and they're non-harmful. So most patients continue this for life. I know I will. I know my husband will, my mom, my dad, my in-laws, best friends that have had this therapy, but you can stop at any time. But there's no age that you have to stop.
That one goes right into the next question. This is directed toward Dr. Huang, because you have just answered this. Dr. Huang, are you pelleted, or is your family pelleted?
Yeah, I think I answered that earlier, that I received pelleting pretty recently because I became a biotape provider about 2 months ago. So I was pelleted immediately, and like I said, I'm feeling the benefits of getting testosterone as a premenopausal woman. I would say it took maybe about a week for me to start feeling like much better in terms of getting quality sleep, which led to diminished brain fog and more energy to exercise, allowed me to be more efficient through my workday due to the clarity of thinking. Yeah, so I'm getting close to needing my follow-up pellet, and I feel the effects of the testosterone dropping. So I'm going to need to go in and get pelleted soon. Yeah, so I am definitely a believer in that. And recently, after I got pelleted, I had my spouse get pelleted, and then he had some of his friends get pelleted, and they're all reporting a lot of improvement in terms of energy, better exercise tolerance. We have a friend that tracks his daily running, and he's running his paths in less time than before. And so he's competing with himself and very happy with the results.
Very cool.
Yeah.
And you hit on a good point too. So we had talked about patients do this 2 to 4 times a year, but really between men and women, this tends to last 3 to 5 months, and men, it tends to last 4 to 6 months. So on average, maybe 3 or 4 months. And typically the first symptoms that you feel improve are usually the first symptoms that come back when your levels start to drop and you go through your threshold level, wherever that level is at the cellular level, to start feeling symptoms again. So you'll know when it starts to wear off, and then you'll realize, okay, that's where I need to come in about a week before. So when you go and stay up at an optimal level, you're not coming all the way down again. The other pellet is starting to absorb and coming up while this one's coming down. And you just maintain a constant steady state level for optimal.
Yes.
The next question I think we have also addressed, can we buy these supplements from your company? So yes, we can sell them right through our clinic. We do have also this promotion where you can get the bundle with your procedure just this month. But yes, they can be purchased through our clinic. The next question is, how old do you have to be to start the hormones, both in men and women? Is there a difference?
Yeah, so typically the youngest age is mid to late 20s for women and 30s for men. If your levels show extremely low at a younger age, then there's other tests we want to look at and see if there's any other reasons versus just start giving it right away. But that's typically when most start, is 20s for women and 30s for men.
Great. Next question, Julie, does hormone therapy harm the thyroid?
Hormone therapy improves the thyroid. If you're asking about bioidenticals and human identical, thyroid is one other thing that we look at and optimize, and is very, very widely underdiagnosed. I won't get into the weeds, but most providers, conventional medicine is looking at what they call a TSH level and really not anything else. TSH is just like the thermostat. It just notices when we have hormone or not have hormone to stimulate. It's a thyroid stimulating hormone to stimulate the thyroid to produce thyroid. Well, we want to know how much actual thyroid we have in our blood, which is that T4 and T3. And that's where we talked a little bit about in iodine, how it supports the thyroid. So those are very crucial letters or numbers to look at. And there's an optimal versus a normal thyroid level as well. Hormones in general support one another. A human identical, there is no harm. And it's going to not damage any other thyroid or any other type of systems, but definitely will support it. Anything else you want to add to that, Dr. Huang? Did I hit that okay?
Yep, no, I think you hit it right on the nose.
Great.
So there's a few more questions. It sounds like we have some young listeners out there. This is just more clarity. Is there an age that is too young to start the hormones?
So kind of right back to if you're in your 20s and you're a male, or if you're young 20s and a female, that's a long time to receive pellets. And typically we want to look at a couple other tests to ensure there's nothing else that's impeding why your levels are so low at that young age. So typically, no. Rare occasions. I know of some boys that were 20 and 21. Their father thought it would be cool to put them on synthetic steroids to beef them up to play football. And it just fried their testicles completely. And there was no hope. And they were severely depressed, almost suicidal. And that is where we wanted to help with hormones. But typically, no, we're not going to pellet any younger adults or younger children, of course. But when it comes to BioTE's method, when it comes to nutraceuticals, I have my kids, even when kids are 12 and 16 now, but when they were 3, I had different type of probiotics and nutraceuticals in them, because their food is what we're eating too. So nutraceuticals, the peptides have been seen in infants as well. Just depends on the type.
Great. So there's 2 more questions. The next one is fairly specific. It might lead to a consult with Dr. Huang to answer this one. Would you recommend this program for a man who is in his mid-20s but has testosterone around 300 and suffers from low energy and sex drive?
If those symptoms, along with the levels, along with medical history and everything that Dr. Huang will discuss with him at a consultation, match up, then personally, I would say absolutely. Why wouldn't you? Why wouldn't we want to improve depression, improve the symptoms that you're having? And I'll leave that. Yes, I agree. It's more of a Dr. Huang and that patient's experience and consultation.
Yeah, certainly after a consultation, if we decide that you're an appropriate or candidate for pelleting, that is a scenario where, which I've seen a lot, where testosterone can be helpful.
Great. And the last question I think I can answer. It says, do you need to do the blood work at your clinic to receive the bonus? So our bonus is given after the procedure. And so after you get your blood work done and you have a consultation, we do offer to do the blood work here in our clinic because it's a bit more pleasant than some of the labs. You do not have to do it here. That one's up to you. But after the procedure, is when you'll get that bundle of nutraceuticals, so you can take that home and start that next step every day.
Yeah. So if you come in with blood work from another clinic and that's recent and it covers all of the tests that we need, then certainly we don't need you to repeat your labs. But the offer is for people who follow through with pelleting. Yeah.
That's a great point. And yeah, and I know, Dr. Huang, you just stated if labs were done by a different clinic, what we've seen a lot of the time, there's missing items that are needed and crucial, but for the ones that are done, and like you said, the right amount of time, then those are definitely usable. Yeah.
Great. So I think that's all the questions that we have. The last one is a clarification. It looks like I read the first question wrong. So I'll read this. It says, I am not taking birth control pills. That was an answer to her question about hormones that cause cancer. Is this program used by women with hysterectomies or only for women with a uterus?
Okay, great. So it is for women, with or without a uterus. So me personally, I'm in my mid-40s. I have a uterus. I still have periods. I'm premenopausal. I have testosterone pellets. I take thyroid nutraceuticals and some peptides. There's women who have full hysterectomies, postmenopausal, endometriosis, PCOS, breast cancer. They're all just going to be different. They're going to be individualized for safety and efficacy for you. So yes, all women. I don't know of a woman, there's only a few actually. It's only a couple times that we would avoid doing pellet therapy at the time. And that is if you are pregnant. If you become pregnant, there's no worry, there's no concern, but we're just not going to continue pellet therapy if you became pregnant. And then any man who is wanting to conceive and actively trying to conceive, anytime you supplement testosterone, it will reduce the amount of sperm that are made. So we would just typically wait until you've conceived and then the man is ready to receive therapy if they wish. Does that answer everything?
Yeah, I think that's all.
Yeah, I think that's all the questions.
All right, awesome. Thank you so much for everyone that was attending here. Obviously on this screen, how you can reach Portland Regenerative Medicine Center is by their website, an email, info@portlandregen, and of course their phone number, 503-852-9680. Where you can also find even more information if you're interested, if you go to bhrtvideos.com. Dr. Donovitz, our founder, is where he does a lot of short videos where he calls BioTeach, and we teach you simple 30-second to 3-minute videos on what's the pellet made of, does it hurt, what happens if I have breast cancer or become pregnant, all the things we kind of touched on, but a little bit more depth. So my suggestion, definitely reach out to Portland Regenerative at their email or their phone number. And I want to thank everybody for coming tonight. And I just want to remind you again, hopefully you have learned something, you feel a little more empowered about the differences of opinions or statements on hormones, if they're harmful or if they're beneficial. And I want everyone to, realize that I believe you deserve to feel your best, to function your best, and have all the options in front of you to discuss with someone who's educated like Dr. Huang and her team at Portland Regenerative to reduce risk of disease and be alive to your fullest, right? We want to be alive and live life, not just be alive and not have a lot of things to live for. So thank you so much for joining me tonight and us tonight. We appreciate you guys. There will be a recording. We'll send this out as well, and wishing you all to be well and be healthy. Thank you so much. Bye-bye.
Good night.